In this video, I'll show you the real medical quick fixes for hair loss. Not marketing myths, not social media trends, but what actually works in real patients. Because hair loss is not a shampoo problem, in most cases it's a medical one. Hi, I'm Dr. Jamalvandi. I'm a medical doctor, and on this channel I explain up-to-date medical topics in simple, practical language. If you're losing hair or if your hair is thinning, this video can save you a lot of time, money, and frustration. Make sure you watch until the end because I'll explain which types of hair loss are reversible and which ones are not. Hair loss is a signal, not random. One of the biggest mistakes people make is thinking hair loss happens randomly. In reality, hair loss is often your body sending you a signal. Something is off internally. And unless you find and fix that cause, no product will truly work. Step 1. Blood tests. Always first. The very first step in proper hair loss treatment is blood testing. If you skip this step, everything else becomes guesswork. Thyroid test. Your thyroid gland controls your metabolism, and your hair follicles are extremely sensitive to thyroid hormones. Both hypothyroidism and hyperthyroidism can cause hair loss. Even mild or borderline thyroid problems can lead to significant hair shedding. Important tests: TSH, free T4, and sometimes free T3. Liver health and fatty liver. This might surprise you, but fatty liver disease is commonly associated with hair loss. Your liver plays a major role in hormone metabolism, vitamin storage, and detoxification. When liver function is impaired, hair follicles are affected. CBC, checking for anemia. Hair follicles need oxygen. If you're anemic, your body prioritizes vital organs, not hair. A simple CBC helps detect different types of anemia that can cause hair loss. Vitamins and minerals, common but often missed. Now let's talk about something extremely common: micronutrient deficiencies. You can have low vitamins and minerals without feeling sick. Vitamin D. Vitamin D acts like a hormone in the body. Low vitamin D levels are linked to increased hair shedding, poor hair follicle cycling. Iron. Iron deficiency can cause hair loss even when hemoglobin levels are normal. Ferritin levels are especially important. Magnesium. Magnesium deficiency increases stress hormones and inflammation. Chronic stress combined with low magnesium is a very common cause of hair shedding. Calcium. Calcium is essential for hair shaft strength, proper cellular signaling, and hormonal balance. If any of these are low, treating hair loss without correcting them is like building a house on a weak foundation. Step 2. Hormones, in both men and women. Another major misconception is that hormones only matter in men. That's not true. Androgens, male hormones, testosterone and DHT exist in both men and women. Hair loss is not always about high hormone levels. Sometimes it's about increased follicle sensitivity. Female hormones. Estrogen protects hair follicles. When estrogen levels drop, hair shedding increases. This commonly happens after pregnancy, during menopause, or with extreme dieting. Other important hormones: Prolactin, cortisol, that is a stress hormone, insulin resistance. Hormonal hair loss cannot be diagnosed by looking at hair alone. Step 3. Dieting and weight loss. One of the most underestimated causes of hair loss is dieting. Crash diets. Rapid weight loss sends a stress signal to the body. Hair growth shuts down first. Common mistakes: very low calories diets, extreme carbohydrate restriction, protein deficiency, dieting without professional guidance. The right way to diet. If you plan to lose weight, do it slowly, scientifically, and under the supervision of a nutrition specialist. This significantly reduces the risk of hair loss. Genetic hair loss. Now let's talk about genetic hair loss. This type of hair loss has no specific blood test, is diagnosed mainly through medical history and hair pattern. Family history is the key clue. Treatment options. What really works? Oral medications. When you take a pill, only a small percentage is absorbed. That absorbed amount enters the bloodstream and affects the entire body, from head to toe, so a small amount helps hair. But side effects can also affect other organs. Shampoos and sprays. Your skin is designed as a protective barrier. Only a small percentage of topical products penetrate. They can help, but their effect is limited. PRP, the most effective option. The most effective treatment I personally recommend is PRP therapy. PRP is prepared from your own blood. Platelets are concentrated and injected into the scalp. This leads to thicker hair, stronger follicles, reduced shedding. With repeated sessions, and if hair loss is not very old, PRP can even cause visible hair regrowth. PRP and genetic hair loss. PRP also works in genetic hair loss, but with an important difference. It delays progression. It does not permanently cure genetics. If treatment is stopped, hair loss may return. These patients either continue PRP sessions or choose hair transplantation as a permanent solution. Reversible hair loss. Hair loss caused by stress, dieting, vitamin deficiencies is usually completely reversible. Stress and hair loss. Stress is one of the strongest triggers of hair shedding. It increases cortisol, disrupts hormones, and pushes hair into the shedding phase. Managing stress is not optional. It's part of treatment. Final message. Hair loss is not just about hair. It's about understanding your body. There is no magic product, but there is a medical approach that works. If you found this video helpful, please like and subscribe to the channel. I regularly share updated medical information in simple language. And if you have any questions, feel free to ask me in the comments. I read them. This is Dr. Jamalvandi. Thank you for watching.